Hello everyone, in this video we are going to talk about migraine or headache in pregnancy. Whenever some person has a headache, you need to examine the headache with the help of intensity, location, frequency and the cause of headache. Okay, you need to ask the patient. What is migraine? Migraine generally is a one-sided headache, throbbing headache. What is tension headache? Tension headache is just around the upper cranium. Pain is a tension headache. People take it as a the headache that occurs while the person is in tension. No, it's not the correct definition. Why we take call it tension headache? Because it makes just like some rope has been constricting your head. This feeling is there. That's why it's called tension headache. What is cluster headache? It's a pain around the eye, nose, and on one side. This is a cluster headache. So these are the types of headaches. But actually, what we are concerned about is the classification of headache. Headaches are two types: primary headache and secondary headaches. Primary headaches are due to the white pathology in the head only. For example, migraine, tension type of headache. This is TTH, trigeminal autonomic cephalgias, various other headaches like cough headache, exercise headache. And so much of headaches are described in the international classifications of disease, but you don't need to remember all these things. Secondary headache are the headaches due to another reasons like trauma, infection, vascular disorder, psychiatric headache also included in secondary headaches. Okay, now let's concentrate on the migraine first. Migraine is a throbbing pain, pulsating sensation on the one side of head generally, and is associated with nausea, vomiting, extreme sensitivity to light and sound. It associated with. Now, a very important aspect is aura. People generally, students like me, who was very confused, like why there is aura and what is aura. Aura means visual disturbances. If you have seen in the movies that some person is impressed by some godly nature thing comes in front of him, that the flashbacks and black spots and color changes in there, and in the middle of that the person is staying there, tingling sensation in the face of face, arm, legs. All these things is called aura. Okay, this happens either before the attack of migraine or along with the migraine. Okay, now in this disorder, how we manage while this disorders comes with the pregnancy, because many females have migraine and pre-diagnosed migraine and they come with the pregnancy. So how you need, first of all, include a neurologist. Let the neurologist help a diagnosis of migraine or whatever the headache is there. Don't go in their specialty, just give them what they want to do. First, after they have diagnosed, yes, this is migraine, then you can now manage the things. Low dose aspirin is always a help, because low dose aspirin is always gonna helping the pregnancy as well as the migraine. You can prescribe paracetamol for the headache or antiemetics drugs like metoclopramide for the migraine. NSAID should be avoided in the later in the pregnancy. Amitriptyline low dose can also be used. So it's not a very major deal to deal with the migraine in the pregnancy. Thank you, friends.